pleasure to have you join us today on the program Healthy Living. I am Adesuwa Osawage. Today on the program, we want to look at the kidney. How does the kidney function? If it stops functioning, would you know? If it happens like that, how would you know? What are the things that you should know about, particularly when something is going wrong with your kidney? Is that fever ordinary? That vomiting and all of that, do you think it's ordinary? Some of us don't have this culture of going to the hospital until it is very late. Recently, the world celebrated Kidney Awareness Day, World Kidney Day. A day set aside to create awareness on this disease and of course ways to manage it if you have it, how to prevent it, and how to go about a normal life. That's what we're going to do today, and I have nephrologists in the house who are going to be talking to us, two beautiful ladies. Okay, immediately to my left is a beautiful woman. She's Dr. Mrs. Idoye Keme. It's nice to have you join us on the program.
It's a pleasure.
Okay, I also have Dr. Mrs. Onajite Okaka. Happy to have you on the program too. It's been a while, ladies. All right, not too long ago, just Thursday here, the world celebrated World Kidney Day. What is that day supposed to do for me and every other person watching today? Dr. Kaka, let me ask you that question.
Now, World Kidney Day is celebrated every year. The second Thursday in March is World Kidney Day. And it is a day that we like to increase the awareness of the population concerning the kidney, its functions, and possible problems that can go wrong with the kidney.
Okay.
Now it is an important day. Normally we would even want to do some screening, from free screening, so that people can be aware or know what their status is like concerning their kidney function. But of course, because of the COVID-19 this year and all this, we have to do social distancing and all. We didn't do that this time around. But we have the opportunity again to increase our awareness. Let everyone know the basic functions of the kidneys. They should know the basic symptoms that indicate that something may be wrong with the kidneys.
Okay.
And people should also know the things to avoid. How can you care for your kidneys? What are the harmful things you may be doing that will not help kidney function?
Okay, Dr. Idoye Keme, let me ask you this. How does the kidney function?
Okay, like basically the kidney is a sieve. It's actually what we say to explain to people easily, that its work is to sieve out those dirty things that the body does not need, which will come out as urine, while the good things we need in our body, which helps our building up of our bones, our blood and muscles and tissues, will stay back. So that is one major work of the kidney. But it has other very interesting functions. It's also is involved in blood pressure control. So we will talk later about issues that can come out from when there are blood pressure problems because of the kidney. It's also involved in red blood cell production. For example, our red blood cells, that's the cells that carry oxygen around our body, it needs the kidney. There's a substance in the kidney that is needed that is produced in the kidney. It also carries out control of some other things we call electrolytes that the body may need to modulate, may need to control. So the kidney is very essential. It's not just removal of waste. It has several other functions that it does carry out. It's also important for bone health. The kidney also is involved in that.
Okay. So what could possibly go wrong with the kidney, Dr. Kaka?
Oh, many things can go wrong with the kidney. And several insults to the kidney will lead to failure. Yes. By that I mean harmful things occurring to the kidney will all lead eventually to kidney failure. And when the kidney fails, one cannot survive. Then we begin to say either you do dialysis on a regular basis or someone else gives you a kidney, and we'll talk about kidney transplantation. So what are the things that can commonly go wrong with the kidney? The kidney could get infected. From a urinary tract infection, it can ascend and go and affect the kidneys and cause an infection. If the infection is not treated appropriately and it goes on for a long while, then to eventually lead to failure as well. Hypertension is bad for the kidneys. Hypertension means the resistance to flow of blood in our vessels is very high, and that is not good for the kidney as well. So anyone who has hypertension, untreated hypertension, is harming the kidneys, and over the period of years can lead to failure. Now there are some diseases too that can harm the kidney, like diabetes, which is common. Untreated or poorly treated diabetes for many years can harm the kidney and lead to failure. And all these things I'm mentioning now, by the time it gets to failure, is irreversible. That is why we now say the person will need a transplant or need to continue dialysis. Now I must mention here that some people are born with defective kidneys.
Okay.
It may not manifest initially, but later, as they grow older, it may manifest. But once we identify such disease, we know that they are congenital, that it came with the person from birth, and now it is manifesting. So in that case, we won't say the person, you can't change who you are or where you came from or what genes. You don't have a choice in that. So all we do is, in such persons, you now do all you can to help the kidney last long for the person. Now some people are born with one kidney instead of two. Some are born with abnormally sited kidney. Okay. Kidneys are supposed to be deep in the abdomen, up. But some people may have one kidney or the other lying low, and that kidney that is lying low is open to some form of insult, like one getting into a fight. It can be that bad, getting into a fight, and the kidney is lying low, and the kidney could be bruised and injured. So infections, diabetes, hypertension, and when I say infections too, sometimes, especially in our environment when malaria is endemic, once a person has a fever, we all assume that it is malaria. We treat malaria, but sometimes it's not malaria. It may be, sometimes it may be a pneumonia, sometimes it may be a urinary tract infection, but the person would have taken anti-malarials. So once you treat malaria, by the third day you're not getting well, you should go to a hospital and let a doctor examine you and find out what is wrong. Because sometimes the infection carries on without the person knowing, and they will tell you, I've been having malaria for 2 weeks, for 3 weeks. Just because the body is hot, it's not abating. So they think this is just malaria. It may not be. So infections going on like that can continually affect the kidney, and in the long run, you just feel sick, so sick one day, and go to the hospital, they say your kidneys have shut down.
Wow.
Because sometimes kidney failure can be asymptomatic. That means you may not even know.
No.
The person is feeling very weak, he or she keeps explaining it. Maybe I'm doing too much work at home, or maybe I'm just tired, maybe I just have malaria. They keep explaining it till the body starts swelling. They get to the hospital and they say, oh, the damage has started years before now. So that is why we talk about screening, having at least yearly checks. For those who have hypertension and diabetes, even more frequently, you should go for your follow-up visits to see your doctor, so that if anything is going wrong, it can be tackled early.
Okay, Dr. Doyekeme, please tell us, what are the signs and symptoms?
Okay, like we said, the signs and symptoms are several, but like the area I will want to concentrate more on now is when the failure actually takes place.
Okay.
For example, the infection will actually show like a fever, like my colleague has said. But when the failure has already taken place, what will be the signs and symptoms? One, it will be swelling of the body, as she mentioned.
Okay.
It could also be the urine being foamy, because there is what we call protein in the urine, because somebody is passing a lot of protein. Now, let me explain this very much clearer. Foaming urine doesn't mean that when we pass urine into the WC, it doesn't foam. Everybody's urine foam. But when it stays longer before it clears, and it's persisting.
Like how many minutes?
Well, usually, we will not go timing it, but when you see that it's sustained for a long time, or you pass urine into a container and it's sustained, definitely that is foaming urine. And it's occurring all the time. It's not just something that happens once today and tomorrow it's not there. That's what we are trying to say. Then shortness of breath, because the person is weak. Shortness of blood. Sometimes the person may tell you that the hands are looking pale, the hands are looking pale, or even the face. For some people, they begin to notice it from their face. that is showing that they are beginning to have a low level of blood. So these are some of the problems. Then depending on what is causing it, for example, in my own field, which is pediatric nephrology, is children. Most times, while we know that a child may have a congenital problem from birth, where there is blockage in the passage of urine. Okay. Now, that kind of child may have other things like straining, passing urine, the urine does not take the normal jetting. Okay. So that we know that there's a problem in the pathway. So apart from the fact that the child may be anemic, having shortness of breath, and these other symptoms will be mentioned, they will also have symptoms of what may be causing it. So these are the common symptoms that do occur.
Okay, the program is Healthy Living on ITV, and I'm talking about kidney today. If you have a question, please call in now to ask the doctors, okay? I may not be able to ask all the questions. I don't know what condition you're in at this moment. I don't know if you're having signs and symptoms. I don't know if you're one of those persons who do not like to go to the hospital until it is very late. We just heard from doctors that sometimes you could be asymptomatic. And by the time you get to the hospital, you're almost gone, okay? So give us a call on 052-290-573. 052-290-573. That's the number to call to participate today on the program. The kidney, as we've just heard, is very important, very, very important. So it's not something you should joke about. Okay, 052-290-573 is the number. Do call in and ask questions and then get answers. Do not ask us about drugs, okay? All right, doctor, let me come to you again, particularly when you said that you deal with children, really. Yes. So, you know, most times a lot of children die without the parents knowing what happened. It could just be malaria, and they will keep treating that child with PCM. They will not even go to the hospital to ask a doctor what to do. You just find the parents running to one chemist shop or the other, just treating the child with anti-malaria, and the next thing, PCM, once the body temperature rises a little bit, PCM and all of that. Please tell us the dangers about this. Okay.
Now, it's self-medication. We have always emphasized that self-medication or over-the-counter medications, we really want to discourage that. We know that, yes, a child could have fever and it could just be simple malaria. But most times, like my colleague has also said, it may not be. There are so many conditions that we masquerade as malaria. There are so many diseases, I don't want to start mentioning names, that will manifest with fever. So it's very essential that once your child has fever today, we are not saying wait 3 days. Give him the PCM today, and by tomorrow morning, if it's in the evening, be in the hospital. Because it's only through sometimes going through various kind of blood tests, some urine tests, I'll be able to say, oh, okay, this is the problem. Now, clearly, one thing I want us to understand, even though PCM does not damage the kidney directly, but it does damage the liver. I want to stress that it does damage the liver. And so we discourage parents. I've heard of stories of mother will say, oh, because the child played throughout the day, so for that reason, I'm going to give PCM. No, that is not right. We don't encourage that on a regular basis, a child will be taking that. When a child needs it, yes, but for it to be a routine thing that is done daily, we completely discourage that.
Okay, Dr. Okaka, when one is born with one kidney, what's the hope of that person?
Oh, one can survive on one kidney. And even though we're born with 2 kidneys, sometimes some people have problem with one without knowing, and they only discover that only one kidney has been working just when they do a routine test, maybe ultrasound for something else, and they see the one kidney is so small and shrunken, and they say, this most likely is not working, let's do some tests. So one can survive on one kidney. And that is why when one has kidney failure, you can take one kidney from someone who has 2 good kidneys and transplant in the person who has kidney failure. Okay. Both of them can still live.
And it will not fail at any point. You know, sometimes you hear that once somebody's body is rejecting the implant.
Okay, so after you transplant somebody, in fact, the way God has created us, anything that is not part of your makeup, the body will destroy and reject it. So for you to have a kidney transplant, your immunity has to be depressed or reduced. So once we do the transplant, the person is placed on medications to reduce his or her immunity, so that the body will not destroy that organ. That is what is done. And you have to be on those medications for life.
For life?
After the transplant, you have to do for life. Now, in taking kidney from another person, we emphasize, one person is sick, the kidney has failed. You don't want to make another person, two people sick in the process. So you will only take a kidney from somebody who has two good kidneys and does not have any disease that may harm his own kidney or our kidney later.
That is why selection, there's a lot of selection process. Kidney transplant is not just, oh, I want to donate. It's not as simple, as straightforward as that. There's a lot of selection process. We have to assess the person's lifestyle. What you understand, if the person already is living some risky lifestyle, that person may not be a good donor. But there have been research that shows that most donors outlived the people they gave. So it's a good thing to give a kidney. That's what we are trying to emphasize. That yes, it's possible, it's a good thing, because we now know that most donors, they outlive the people who they gave it to. So it's not harm to that person donating, as long as that person does not do have a risky lifestyle that can harm the kidney. When we say risky lifestyle, this going over the counter to get drugs, it's a risky lifestyle. Just taking drugs indiscriminately is a risky lifestyle. Then if you are not also into combative sports whereby, like, well, in Nigeria, not much of that is going on. But like overseas, American baseball, all those are very serious.
Kickboxing and the rest.
Yes, those are very combative sports. So with that is a risky lifestyle. And some people just want to die from the sky. Those are risky lifestyle. So once those are not there, and excessive alcohol intake, excessive smoking, you are not there, that kind of person can be a donor. As long as the donor is not having a risky lifestyle, most times they outlive the recipient who they gave the kidney to. So it's safe to donate.
Okay, but it's safe to donate, yeah, but a lot of persons are really scared of doing that. And let's look at the issue of dialysis. On Thursday, a group of persons did cry to ITV that the cost of dialysis is very, very expensive. Before that, let me ask you this question. At what point will one go for dialysis before we then talk about the price of dialysis? At what point does a person go for dialysis?
Okay. Now, it is when kidney failure gets to the very end, and we call it end-stage kidney disease. Then the person now requires dialysis for life or kidney transplant. But let me quickly mention here that when something goes wrong with the kidneys, it can take either of two forms. We say acute if it is something temporary that can be reversed. Then we say chronic if it is something that you cannot reverse it. All you can do is to work on it and manage it, delay any deterioration. If not, we expect that deterioration will occur. But you delay it by controlling the blood pressure, controlling the blood sugar, you delay it. And some people will still die with their kidneys working. So what I mean is they won't die from kidney failure. Maybe something else, like a vehicle accident or something may kill them. So when it gets to end stage, or somebody with acute kidney injury, but this acute now is temporary, so they just need some sessions of dialysis. Once they recover, the kidneys wake up. So if it's not that kind, then they need it for life once it has gotten to end stage. Now, dialysis only does one of the kidney's functions: the filtering aspect, the removal of impurities aspects and waste products. That is what dialysis does. So those who are on dialysis also need to buy erythropoietin, the hormone that the kidney produces to help us make blood that the failing kidneys will not be able to produce. And that injection is expensive. The patient on dialysis still needs to control his blood pressure so that he will not have a stroke or any other complication of hypertension. The patient that has diabetes and is in kidney failure may still need medicines to control the sugar, depending on whether the sugar still goes up. So dialysis is just one function. but
Just
it's
life.
life. Yes, but
Yes.
it is life preserving. You now give other medication, for example, vitamin D, which the kidney also produces. You now give it to the patient as supplements and all that. So you manage the other things and let the dialysis machine do the filtering. And they have to do that like 3 times a week.
3 times a week.
They have
It
to do
cannot
3
be
times.
less than 3
If
times.
it's less than 3,
Ideally,
they'll be
it
sickly.
should be every day. It is just the optimal that is able to keep people for life, that is 3 times a week. So ideally, it should be every day. And some people actually dialyze every day in some parts of the world.
Pregnant women, the kidney failure, dialyze every day.
Oh, please tell me about that. Pregnancy and kidney failure.
Yeah.
How is that woman going to live?
Oh, she's already living with, some of them are already living with
The
kidney disease. And they want to have a baby. And they succeed in achieving a pregnancy. They now have to have the dialysis of the baby every day.
Yes. And when it's time for delivery, is
They
it
will have the
normal
baby.
or they have a C-section?
Okay, it depends. You know, having a C-section, there are a lot of factors that will determine whether a woman should have a C-section. If you feel that the baby is not doing too well, you don't want to stress the baby, they do a section. If you feel that the baby is too big, or maybe so, it depends. The gynecologist, the obstetrician will take that decision. And usually, the decision to do a C-section is either because of the mother or because of the baby.
The baby.
And they will take the appropriate decision when the time
All
comes.
right, it's 052-290573. Give us a call. Call into the program and ask questions on this topic we're talking about, your kidneys. They are very important. You know, sometimes people we've heard stories of some persons traveling abroad to just go and donate their kidneys freely for money and all of that. What's the risk?
Now, the problem with that is, it's like a business. So, they will not be thinking of the welfare of the donor. I mentioned before that one person is sick, you do not want to make 2 people sick.
Yes.
So you only take a kidney from somebody who has 2 good ones and he does not have a disease that can affect his kidneys in future. For example, you don't want to take a kidney from somebody who has hypertension. You don't want to take a kidney from somebody who has diabetes, because this hypertension and his diabetes can potentially harm his own kidneys. You don't want to take a kidney from somebody who is HIV positive, because HIV infection can hurt the kidneys and make that person go into failure. People with hepatitis B infection, hepatitis C infection, you don't want to take kidneys from them because they already have something that can damage their kidney. But in the case of commercial sale of organs, nobody's going to be looking out for that person. I want to donate for money. I want to donate for money. The person is not looking at, okay, do you have any condition that will make you... So that is the problem.
Is it not a crime to so do?
Well, it's against, there are laws.
There are laws.
There are laws against the sale of organs. There are laws. It's not, if people want to do it, they have to do it discreetly. There are laws against it.
Okay, you did talk about swollenness when somebody's kidney is malfunctioning or start giving problem. You know, sometimes you just see people, they get swollen feet, swollen feet and all of that. Is it every time that this happens that you can relate it to or ascribe it to kidney problem?
Okay, one common way the kidney presents is by swelling of the body.
Okay.
Like I mentioned that the body filters the waste, and then what is waste comes out as urine.
Yes.
Now, when the body is not able to do that,
do that.
it's not able to filter water, because it also regulates water too. The kidneys regulate water. So because the kidney is not able to regulate water, what happens is that the urine, the water stays back in the body and begins to swell up. Also, because of loss of protein, when excessive protein is lost out in the urine, the body will not be able to keep water in the blood, and then water now goes to the tissues. So it's a very common way that the kidney manifests that is ill, when the kidney is not working normally. But like you rightly said, there are some other diseases too that can present with swelling body. For example, when they have heart conditions, people with heart conditions, when they are in failure, can also have swollen body for other reasons.
Okay.
Also, liver diseases can also have. So, and there's no way somebody will just know that except you do a barrage of tests. And through this test, we're able to say, yes, it is the kidney and not the liver.
You know, when it comes to the issue of health, a lot of us take it for granted. You know, nobody wants to go to the hospital. We want to wait till something has really gone wrong before you see people rushing emergency, and all of that. You know, nobody just wants to. I don't think I've ever walked into the hospital to say, okay, I want to do a full test. I just want to run a test. You know, I don't think I've ever done that. Can you just tell us, you know, encourage us a bit so that, you know, some of us who have never done that will go to the hospital and say, okay, I want to do a full body test and all of that. Okay. Particularly women, we like to buy clothes, we like jewelries, we like to save money for meetings. You know, we want to do things, but not our health. A woman is 60, I beg, go and buy me this drug from that place. Or, Dr. Kaka, what drug did you use that day for your malaria? I beg, just tell me, let me go and buy. You know, we are like that. That is how women are. Okay, most of us women. You know, that is how we are. So please just, you know, as a doctor and as a woman, can you just tell us something?
But I want to quickly mention here that somehow the women are better off than the men. Really? And I will tell you why.
Please do.
Because when women of childbearing age have to go to the hospital to have a baby.
Definitely.
They have to go attend antenatal clinic. So when they go to the antenatal clinic, they have their BPs checked. Their urine is tested for protein as well. So somehow, if a young woman develops hypertension, they tend to identify it. Maybe when she goes for antenatal care and all that. But for the men, if they don't feel sick, they won't go. Or if you feel sick, you treat malaria, you won't go. So I feel that in a way, the women are better off as per the health compared to the men. But in terms of encouraging us to have yearly checks, well, we always say that once anyone gets to the age of 40, compulsory, but before those before 40 that already have issues have to go.
They have to.
In fact, they have to be going for follow-up checks with their doctors. So that's different. But for those who didn't have any issues before, from the age of 40, you have to make sure that you have a check. For example, now if it's a woman, she shouldn't have started having pap smears before then.
Okay.
Yes. Or we all know about breast cancer and examining the breast, then going for a mammogram. Now, in UBTH, the CDC, you can go there for a comprehensive health check.
Okay.
And they don't ask for a large amount of money. It's something that is affordable. Okay. And they will do the basic screening and the basic checks for you, both male and female. So, at least blood pressure would be checked. So the women, they will examine their breasts, they will do a pap smear, they will check the blood sugar. We check the blood sugar, check the cholesterol level and all that. So the basic things will be checked. And if there's any red flag raised, they will refer the person, yes, to the appropriate physician.
All right, we're on the program Healthy Living on ITV. We're talking about the kidney. Do you have problems with your kidney? Think about it and give us a call on 052-290573. When we come back, we'll do more. We'll take a very short break. Stay tuned. Thank you very much for joining us on the program Healthy Living. What is the kidney?
The kidney is an excretory organ in the body, which is for metabolism.
Tuberculosis affects many organs in the body, but the common ones it usually affects is the lungs.
Epilepsy is a neurological problem.
Okay.
It is an injury in the brain, which causes someone to begin to convulse, to go into fits.
It is curable, but the cure is a long-term thing.
If you eat well and avoid those risk factors that will make your immunity to be down, then the risk of contracting tuberculosis will be reduced.
If you're healthy, then you're wealthy. Thank you for staying with us on the program Healthy Living, and I'm talking with two beautiful doctors in the house who are experts in the field, okay? with Dr. Najiti Okaka and Dr. Idoye Yekeme. I kind of like their names a lot. We're looking at the kidney. Now let's concentrate on the children, because we seem to neglect them a lot. And these children sometimes they don't even know what is wrong with them. Now when a child is born with one kidney or malfunctioning kidney or kidney that is already damaged from birth, what could be the reason for that? Is it what the mother did? Or, sometimes all of these bits, those of us who are not in the medical field hollow, how can somebody be born like this? What could be the reason?
Okay, thank you very much for that question. Unfortunately, we really don't have much answers. These are things to do with the gene, what we call gene, and there are errors during formation of the babies that really nobody is to blame, not the mother, not the father. It's just an error that occurs during the formation in the gene, and with that gene abnormality, the baby is formed. Like we mentioned before, the kind of abnormality that can occur is sometimes there is only one kidney, but interestingly, like we have told everyone, somebody can live with one kidney perfectly, and you will never even know until the person dies one day and they do an autopsy, and that is when it's discovered. So also, but there are some other kind of kidney abnormalities that do occur, and urinary tract abnormalities that is more common, and one of the ones I'm very passionate about is the posterior urethral valve. I know it's not, I want just to mention the name so that we know about it, but all it's about is that where urine comes out, which we call the urethra, is blocked right from birth, and this occurs in male children. And one simple way of knowing it is when the baby is born, the urine does not jet. Or even if we do not know on the day the baby is born, when the baby is circumcised, I'm very happy in Africa we circumcise our male children. The urine will not fly. Ideally, we make a joke that when you circumcise a baby, if the baby passes urine, it should enter the mother's mouth on the other side. So if that has not happened, that is a problem. And it's easier for us to deal with that problem early, because one thing we notice that once that obstruction is there, that blockage is there, it's already there when the baby was being formed in the womb. And the implication of that is that the kidney is already being damaged from the womb. So if you don't come early for us to fix that problem so that urine starts to flow out normally, by the time the child comes, most times the kidneys are totally damaged. And that is why we encourage mothers, please don't rush, especially when you have a male child. Don't rush home. I know we are always excited, we want to go home. Yeah. But let a doctor or a nurse see that jetting of the urine has taken place, and at least the doctor and nurse is satisfied before they go home, or so that they can advise you on what next that can be done. This is very important, because we see these things, we see a lot of patients that have this condition. And the one that paid me the most is when we now see a child who is 9 years old, having this problem.
Hello, let's put it this one. Hello, caller. Good afternoon.
Good afternoon. I'm enjoying your program.
Thank you.
Please, how can somebody avoid this kidney problem?
How can somebody avoid kidney problem? What's your name, please?
My name is Lady K.
Okay, happy to hear from you. All right, doctor, we have a question.
Okay, thank you very much for that question. Now I'm going to tell you things you should do that can help your kidneys.
Okay.
Number one, drink water. Drink enough water. Water is the best beverage. When we don't drink enough water, what happens? Our urine is concentrated. And concentrated urine is most likely to form stones. And kidney stones can damage the kidney. It can damage the kidney and also lead to failure. So we should all drink water. Water is the best beverage, just that, well, we need to take something sweet and other things. So drink water.
Like how many glasses of water you take? Because sometimes they will tell you take 1 liter, 2 liters, 4 liters, thereabout.
Okay, what can guide us about how much water to take is look at your urine. Okay. Anytime you pee and your urine is dark, it means you've not taken enough water that day. But on the average, adults should take at least 1.5 to 2 liters. For those who are stone formers, we usually say they must take at least 3 liters of water every day, so that to reduce the chance of them forming more stones.
Hello. again.
All right, Jane, reduce the audio level on your television set.
Okay.
Okay,
Apart
thank
from
you.
the swelling of the body, is there any way to know that you have kidney problems?
Did you get that?
Yes, I did. Before I go back to complete answering the previous question,
Yes.
one thing unique about body swelling from kidney disease is that you tend to see it in the face in the mornings, and then as the day progresses, it goes down.
Okay.
Swelling of the face or swelling around the eyes. But as the day in the morning when they wake up, and people will be like, around the eyes, and so we think maybe an insect bit me at night or something.
Because I ate rice for dinner.
Yes, a lot of people say that.
So
I ate rice for dinner.
okay.
What's
So
the relationship between
There's
rice and swollen of the face?
There's no relationship.
No relationship.
No relationship.
So swelling around the eyes in the morning, the face is puffy in the morning. As the day progresses, usually we suspect kidney disease. Usually, and didn't say always.
Okay.
Then going back to what we should do to help our kidneys, apart from drinking water, you have to avoid medications that are harmful to the kidneys. And I must talk about painkillers,
Please.
because we can easily buy them over the counter.
And we abuse it a lot.
And some of us who our jobs are very physical, at the end of the day you are tired, your body is aching, you want to take painkillers, and they go and buy a cocktail of painkillers. Some of them are taking 2 or 3 in combination.
Yes.
It is not safe. Those painkillers are not kidney friendly.
Okay.
And if you take them on a regular, yes, painkillers like we call them the NSAIDs, like ibuprofen, naproxen. I'm not calling trade names now.
Yeah, I get it.
So those chemicals, they are good in that when your body is aching, you take them, you feel like you're in heaven. But taking them continuously over a long period can damage you.
Let me say, a drug like tramadol that went viral can actually kill somebody.
Tramadol,
A lot of persons take it in excess and they abuse it
Yes.
because they just want to feel, high or something.
Yes, but tramadol does not belong to this group of
Okay.
painkillers. It doesn't. Taking tramadol in excess, of course, is harmful. But it does not belong to this group of drugs, as I say, the NSAIDs. I'm saying these are also the group of painkillers that can also make somebody develop a peptic ulcer disease, because it can cause ulcerations in the stomach. So be careful the medicines that you take. Now, those painkillers, doctors also prescribe them, but we always prescribe them for a limited time.
Okay, so
But when people buy on their own,
let's do. Hello, caller.
Hello, good evening.
Yes, thank you for joining us. What's your name, please?
My name is Barnabas.
Okay, please ask your question.
Huh?
Go ahead with your question.
My question is that what is the cause of that kidney stone? What is the cause of kidney stone?
Okay, Barnabas wants to know the cause of kidney stone.
now I have mentioned one already, not taking enough water. If you don't take enough water, your urine will be concentrated, and the urine that is concentrated, crystals can form in it. Now the urine contains chemicals. When those chemicals are so concentrated because there's too little fluid in there, we form crystals, and this will form stones. Now that is one. Not drinking enough water can predispose somebody. But then your diet as well. There are different types of kidney stones. There is kidney stone that one can develop from eating too much meat. There's kidney stone that one can develop from taking too much alcohol.
Too much of meat is not even enjoyment.
No.
Never, it has never been. You may not be overworking your kidneys
Okay.
to eat too much meat. Your meal should be balanced. You should have all the different aspects of food there represented. The energy giver, that's the carbohydrates. You have the protein to replace one tissue and cells. But not that you just have one plate full of meat and you're eating, you say you're enjoying life. That is wrong eating.
Okay.
So, talking about the stones, taking too much alcohol, there's a different kind of stone it can cause too from taking a lot of alcohol. Then some people may have had some abdominal surgery before that may predispose them, but there's one basic thing. No matter the cause of the stones, drink a lot of water to prevent your forming more. But by the time you come to the hospital, We take a history from you to try and find out why are you having these stones, so that you can avoid such things in your diet or such drinks in your diet. Now, still talking about how we can take care of our kidneys, I want to talk about skin bleaching agents.
Bleaching agents.
I am.
Doctor, louder. Increase the volume on that.
I want to talk about skin bleaching agents, because now in our time, your complexion is your choice. If you see someone who is dark, the person wants to be dark. I know some people are born fair, but because of the agents we have these days, even those who are born dark and want to be fair, we bleach the skin. So you see somebody dark, the person is remaining dark because she wants to be dark, remain dark. And it's not only ladies who bleach the skin. Now we have to be very careful, because some of these bleaching agents contain chemicals that are harmful to the kidneys. Now some people will be like, oh, I know that's the other lady, she's been bleaching for years, she's been fine. But you, both of you don't have the same genetic makeup. Maybe you already have something wrong with your genes that predispose you to hypertension, for example. You go and use a bleaching agent that contains mercury. Everything will combine and give you kidney disease. So, as much as possible, we should avoid those bleaching agents. Even somebody has even asked, what of the organic ones? Okay. The organic ones, what is the active ingredient in it? You have to know what because you just see all these things, you don't know what the active ingredient is. Could be risky. And treatment for kidney failure is not cheap. If you thought you were even rich before, once the kidney fails, then you know that you don't have enough money. And even having a transplant is not like the native kidneys you were born with. So kidney disease is best avoided. So let's drink water. Let's avoid medicines that are harmful to the kidneys. And I want to say sometimes some herbal medication we take may be harmful because you don't even know what the active ingredient is. Maybe something harmful to the kidneys, you don't know. Bleaching agents.
In the face of COVID-19, where everybody's running
to herbal medicine. Now, if you have hypertension, treat it to protect your kidneys. And medicines for hypertension you take every day, like food. The medicines have become food for you. So don't feel that it is punishment. Oh, doctor, why do I have to take pills every day? Is this not suffering? It is not suffering. It is when you develop the complications, like a stroke, or kidney failure, or heart failure, that is when suffering has begun. Hypertension is called the silent killer, because it will be there and you won't have any symptoms. Some people tell you, oh doctor, I know when my BP is up, I have a headache. I say no, even when you don't have a headache, your BP is up. So treat diabetes. Some people don't want to be disciplined with their diet. You know, we all know that this bottle of Coke, it is when you are told that you cannot drink it, that is when the temptation is greatest. But let us try. Diabetes cannot be treated without appropriate diet. Don't deceive yourself. Don't think I will just take all the medicines and then I will not follow the diet. You have to follow the diet. And the diet for diabetes is not only beans. Once you see a dietitian, he or she will guide you appropriately. What is forbidden and what is not forbidden. Because the main thing, one of the major things you must look out for is your portions, food portions, food portions. Gone are the days when we want to eat rice and we heap a plate full of rice. We don't need that.
All right, I wish we could go on and on and on, but time, they say, is usually short when you're enjoying yourself on air. But don't worry, we'll do this topic again so that you can contribute. Ladies, I want to say thank you very much for finding time to be with us here to educate us on the need to take our health very serious, particularly when one has underlying ailments like hypertension, diabetes, HIV, and the rest. The kidney must be protected, because once it fails, that is when you will know that you are not actually rich, according to Dr. Kaka. Okay, those are words on marble. Take it very serious. Hold it tight. Hold it close to your heart. and do the needful. Those days are gone when you eat meat and say, I didn't enjoy. You did die, not the enjoyment. Okay? So doctors, thank you very much for being here. We'll see you again on the program on Monday. Bye-bye.